One of the key things with passive is even if there isn't a shoulder pain or a shoulder condition, it's very difficult for someone to completely let go of a limb. We carry them all day, we're constantly having a level of tension through that area. So for someone to actually physically relax, it's very difficult for some people to relax anyway. And if they're in pain, it's really difficult. So you do need to make sure that when you are assessing somebody passively, you are nice and close to your patient, you are supporting the joint, and then you want to come right in and take the full weight of the arm, okay? Because this way, my patient will feel like I have them. I'm completely supporting them, so I can now slowly lift their arm into flexion, bringing it back into extension. Very good. And relax for me, keep relaxing, there we go. Into abduction just there. And having a feel of the end range and what that joint is doing. What I'm doing by doing passive is I'm looking to see whether we get the same pain. I'm feeling the end range to see what it feels like. Does it feel just restricted tight? Or does it feel like I'm getting to a certain point and it's a hard end, feels like there's a bam, no movement. You know, all this information, again, are pieces of the puzzle that will help me determine what's going off with the shoulder. Okay. One key tip as well is if I just bring his hand up, what I tend to do is I bring my fingers into the palm, and then as he relaxes, I'm now pushing his elbow into mine so he can relax completely. If I was to just hold the arm like this, a lot of the time it's very difficult for them to completely let go. I'm more guiding the arm than fully passively, and it needs to be passive, okay? Because when we're doing passive again, the other thing we're testing is we want to know whether it's muscle that's causing the pain or whether it's joint. So when he does the movement, obviously his muscles are going to get involved, and therefore if there's a problem with the muscle, it would be a clear ow, that's painful. So passive ultimately is to try and take the muscles out to feel the joint, and then we're getting the same problem. Okay. Now again, it's very difficult for somebody that's in pain to fully let go. So if you're still getting pain, you can't fully, 100% say it's not muscle, but if you're doing a very good passive in terms of they are completely relaxed, it does help to just steer you away from whether it's muscle or not. Okay, again, another piece of the puzzle. So once I've done observation, palpation, active range of movement, I've obviously done passive, I do the good side first, and then I do the bad side, okay? I'm then going to do a series of special tests. Now, depending on what condition I think it is, depends on what special tests I may choose to do. But there are a few key ones that I often do for most shoulder conditions, just again to help me rule in and rule out certain conditions. So whether it's a shoulder impingement or whether it's bicep tendinopathy or isn't, a bursitis, for example. So lots of different things can help, all these different special tests will help to determine which one it is and therefore how I'm going to treat it. Okay, so I'm going to just run through the key special tests now, and then I'll show you some extra ones should you feel you want to add some more in. Okay, so the key ones I would start with, so whilst he's in that position, so straight away I'm going to ask my patient to sit up. Okay, because if we're slouching, so if we sit down, you can see straight away the shoulders drop forward. Shoulders drop forward, we're going to start encroaching into this subacromial space. And obviously if there's a shoulder impingement or something going off with this glenohumeral joint, it is going to aggravate it sooner and more intensely. So if we just simply lift through the lumbars, helping our patient sit nice and tall, that instantly takes the shoulders back into a better anatomical position, allowing us to test the shoulder a little bit easier. So special test, we're going to start with a Yocum's test, which is a good for shoulder impingement. We're going to start again with a good shoulder. So I'm going to ask my patient to put his hand, his good arm's hand on his bad shoulder and ask him to try and touch his forehead with his elbow. So you're just going to lift up for me. perfect. And back down. So he shouldn't be seeing any problems there. He should be able to reach his forehead, no problem, with no pain. And then, of course, we would do it with the bad side. So again, this time on the good shoulder, elbow to the forehead. And on this one, if there was a shoulder impingement, what I'd expect to see is he'd probably struggle to get to about this point. He wouldn't want to go any further. He might not be able to go any further, and it would start causing pain. So that's one test just there. The next tests are what we call empty can and full can. So I would ask my patient, you can do this standing, but I find it's probably best seated. And we're going to bring the shoulders, so bring the arms out into what we call the scaption. So they're in line with the shoulder blade at the back just there. So full can, hands are up, so think about the thumb, so pointing upwards, or imagine you've got a can in your patient's hand and you're holding it where it's going to obviously not pour out. And you're simply, again, good arm first, ask your patient to gently just resist some pressure. Okay, and then once you've done one side, you're then going to do the bad side. If there was a problem, what we would find is that he would instantly get pain and he wouldn't be able to have the strength to keep the shoulder in that position. Empty can, same position, we're just turning the wrists fully round. So we're going into internal rotation. So imagine again, you've got a can in your hand and you're now pouring it out. I'm now going to do exactly the same again. Good arm first, asking him to resist, and then bad arm. And again, if it was painful, he wouldn't be able to resist that and it would cause a lot of pain. We're then going to go into speeds test. So speeds is for the biceps. So we have a nice straight arm just there. There's lots of different versions of all these tests, just to kind of be mindful as well that I think there's about 3 or 4 different core books that give you all the information on how to do these special tests. And each one has a slight deviation on how to carry it out. So you've got to, of all these special tests, you've just got to take it with a pinch of salt. It is a piece of the puzzle. All your information that you took from them, the active, the passive, the palpation, everything, it's all gearing you up. So this is just one element. So don't worry if it's not 100% perfect, but it gives you an indication. So you want the shoulders relaxed, arms straight. And then what you're going to do, again, good arm first, you're just going to place a little bit of pressure. And again, we're just feeling to see whether we can hold that, and the same here, okay? If there was a problem, straight away the arm would go down and he would get pain in the anterior shoulder, okay? So we've done empty can, full can, Yocums at the beginning, speeds. We've got Hawkins-Kennedy. Now, Hawkins-Kennedy is one I had the privilege of going to observe a consultant, shoulder consultant, and this is one of the key tests that he would do on a regular basis. So he would, and I'm doing it on the bad arm, but you would do it on the good arm first, but just for demonstration purposes, you would bring the arm into kind of 90 degrees at the side, and then you would try and get them to relax. Okay, so just let me take the arm. That's it, perfect. Let them relax. And it's really important just sometimes just give them a little bit of a wiggle, just allow them to let go of that arm. And then you're slowly going to take the arm into external rotation and just feel into different ranges through there, just to have a feel of what's going off there. And then you're also then going to go into the internal rotation, just there. And this is the true test of what we're feeling for. We're feeling for any tightnesses, any restrictions, but ultimately we're trying to recreate the pain that the patient is getting. As awful as that sounds, we want to recreate it, because if we can aggravate the pain, then we can work out what structure is actually causing the issue in the first place. Okay, so they're the key tests that I would do for most shoulder conditions. There are others which I will show you, but they are the go-to that I would do for majority of the conditions that we're talking about today. So I'm going to show you the scarf test. So the scarf test, we want to place our hands over the shoulder just to stop any excessive elevation or retraction through the shoulder girdle. So we want to just support there. And then what we're going to do is bring our patient's arm up and then guide them across and trying to close down the space within the shoulder just there. Again, with all these special tests, you would always do the good side first, and then you would then repeat the test on the bad side. Today I am going to just show you these tests on one side. So I'm just going to show you that again, supporting the shoulder, bringing the elbow up, elbow into 90 degrees just there, and then we're going to bring the arm across the body, closing the space down within the shoulder joint just there. Okay, and any kind of shoulder impingement would highlight there. You would be getting quite a bit of pain, and the restriction through the shoulder, they wouldn't be able to get that range of movement. The next test we've got is the Yergason's test. So this one we're going to bring the elbow into the side, elbow at 90 degrees, and we're going to have our patient come into full pronation. We're going to palpate with our other hand. We're going to palpate the long head of the long bicep tendon just here. And we're going to ask our patient to try and supinate. So from pronation, they're going to try and supinate their hand, and we're going to resist that movement. So Mike, if you can try and resist there, perfect. And what we're trying to do there is provoke any pain through the long head of the bicep. So again, causing kind of retesting that tendinitis, that bicep tendinitis. Next test would be an apprehension test. So if we ask our patient to lie on their back, this one's a good one for if we're suspecting a slap lesion. So a slap lesion is where we're talking about the labrum of the shoulder. So if you think that labrum around the glenoid has become injured in any way, the shoulder can become unstable. So what we're trying to do here is we're actually trying to take the shoulder to a range of movement that would make it feel quite unstable. So we're going to be watching our patient. We're going to do this one very, very slowly. We're going to bring the shoulder into 90 degrees of abduction just here, the elbow into 90 degrees of flexion, and we're slowly going to take the arm down into that external rotation just there. I'm supporting the shoulder, but not putting too much over pressure on. I want the shift of the humerus to come forward. And if we get to that point, what you can do then is just put a little bit of overpressure, taking the elbow down towards the floor to put a little bit of extra pressure through the shoulder just there. Again, if there's any kind of instability, that would highlight at that point. Okay. Whilst we're in this position, I will show you our last extra test, which is the bicep load test, the second bicep load test. So we're bringing the shoulder into abduction of around 110, 120 degrees, and we're going to have a 90-degree flexion through the elbow. And then what I'm going to ask my patient to do is simply do a bicep curl and push against me. So resist my pressure just there. Perfect. And again, if that was a positive, we would be getting pain in the anterior portion of the shoulder. Okay, so I hope that is helpful. Again, these are just extra tests you can do. There are hundreds of tests for the body, and this is just a few that I've shown you. But hopefully that will just help you give a more thorough examination when looking at shoulder conditions.